Hey. We have started this What to Do Wednesdays. What the heck is What to Do Wednesdays? Well, I've learned by talking to different nurse practitioners throughout the nation that everybody's hospital has a culture and everyone does things just a little differently. This was a way of reaching out to different people and figuring out, what do you do? Today's topic was, when your patient has trouble sleeping, what is your go-to regimen? When the nurse comes in and says, hey, my patient is telling me they're having trouble sleeping, what do you do? I had several people answer this question, and these are some of the drugs that came up. Benadryl, Ambien, Trazodone, Vistaril, Zyprexa, Seroquel, and Rozarem, which is a new one. I worked at a hospital one time and I saw this on their list of drugs that they use for insomnia. I want to share my go-to. My go-to is, number one, to make sure that the room is conducive to the patient actually sleeping. Are the lights on? Is the TV blaring? I make sure that the curtains are drawn. First things first, is the room conducive to sleep? After I check through those things, my go-to drug is usually melatonin. And the reason why I like melatonin is because it's something that the body produces on its own. I read an article one day and it said that the melatonin used to be called the tranquilizing organ because it's made from the pineal gland. And it was also known as the seat of the soul because it would only come out at nighttime. But melatonin is something that the body produces on its own, and it just helps you to get into a nice, comfortable sleep. It's non-addicting and it has less side effects. I deal with a lot of elderly patients in the community where I work, and some of the other side effects of those drugs listed up above sometimes can cause them to be super drowsy, or it can actually have the opposite side effect. I just wanted to share what I do. Thank you for joining me on What to Do Wednesdays. I hope to see you next week. And if you can think of any topics that you would like to be addressed on What to Do Wednesdays, shoot me a DM. Thank you so much for joining, and I'll talk to you soon. Bye.